From the moment we are born, stories play an integral role in connecting us to the community we're a part of. Today we're taking a look at the importance of storytelling and compassion in leading teams in today's healthcare environment. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hederle, Senior Writer for AHA. In this episode, Elisa Arespacochaga, Vice President of AHA's Physician Alliance, speaks with Dr. Emily Silverman, an internal medicine physician at Zuckerberg San Francisco General Hospital and creator and host of The Nocturnists, a live show and podcast where doctors share stories from the world of medicine.
Welcome to another podcast in the AHA's ongoing series where we focus on important issues facing clinician leaders. I'm Elisa Arespacochaga, Vice President of the AHA's Physician Alliance. Today I'm joined by Dr. Emily Silverman, an internal medicine physician at the Zuckerberg San Francisco General Hospital, where she seeks out projects that resurrect the narrative soul of medicine. She's the creator and host of The Nocturnists, which if you have not listened to, I suggest you do. It's a live show and a podcast where doctors share stories from the world of medicine. Today, we're going to talk a little bit about the importance of storytelling in health and in medicine. To get us started, Emily, can you tell me a little bit about yourself and your experience?
Sure. So I grew up in Miami, Florida, and I wanted to go into medicine from a really young age, which was sort of strange because nobody in my family was really a doctor, but I had this really intense curiosity about my body, and I really adored my pediatrician, and those things got me set on the path to medical school. Alongside that, I also had a big passion for the arts and reading and writing and theater, and my parents took me to the theater a lot as a kid and ended up in college majoring in history of art and architecture while doing my pre-med requirements at the same time. So I kind of always had these two sides of myself that were going in parallel. And along the way, I was always looking for ways to cross them over because in my mind, one side of, my brain definitely informed the other and vice versa. And so if you go back and look at all of my medical school admission essays and residency admission essays, they're all about how to combine art and science. And then when I graduated from medical school, I came out to UCSF for my residency. And it was during my residency that I decided I wanted to take on this big project, which was to start a live show where doctors could tell stories about their lives. And that's how the Nocturnists began.
So why storytelling? And you talked a little bit about how the art has always helped you inform your science training, but what made you realize the value particularly in medicine?
Yeah, so I had always written poetry and essays and prose and that kind of thing. And so actually my first thought was maybe I'll just start by doing some writing. And number one, I just had always been someone who loved to write. But number two, I just felt like I didn't have a way to move the experiences through me that I was having in the hospital, just as a form of processing. And so I started posting these prose poems on a blog and posting them on Facebook. And that was nice. And, friends would comment and they would say, oh, wow, that's such a, powerful piece about residency. And I wanted to invite other voices into the mix and give my friends and colleagues the opportunity to lift their voices as well. So for a while I thought, well, maybe I'll have, guest blog posts that are written by other people. But then the blog started to feel a little bit like just a literary magazine, which I love literary magazines, but there's actually already many different literary magazines, specifically medical literary magazines out there, including the wonderful Examine Life Journal, which is produced out of the University of Iowa. And there's another one called Intima, which is produced out of New York. And so I really was thinking to myself, what am I adding to the conversation here? What am I doing that's, pushing things forward and innovating in terms of medicine and creativity? And then I went to see a live taping of The Moth, which I don't know if you or your listeners are familiar with The Moth, but it's a live show where they have open mics where people can come and put their name in a hat, and they pick 10 names out of the hat, and then the 10 people go up and tell stories completely off the cuff. And then, usually they pick a winner, and those winners they coach, and then they put them on stage as the Moth Grand Slam. And then they have a podcast where they broadcast those stories, and you can listen to them just on your phone while you're going for a jog or folding your laundry or whatever. And I looked at this model of the combination of the live show and the podcast too, but really at the beginning it was the live show. And I thought, this is something that's new that I don't see happening in medicine. People coming together in a room to connect and really be vulnerable and authentic is something that I was craving. I was craving that space. So the first show was in January 2016, and I emailed some friends and I said, would you like to speak? And actually got 8 people to agree. And we had an audience of like 30 or 40 people, and the 8 people told their stories, and it was very, raw, and there was no like coaching involved, but it was still really powerful. And people, came up to me afterward and in tears, and they said, this really helped me feel less alone. I thought I was the only one going through this, but now I see that, I'm part of a community. And I think all being in a room together was really important for a culture and community building exercise. So then soon we scaled up to a larger theater that held 80 seats, and we got a write-up in the San Francisco Chronicle. And it was after that that I started getting these messages from physicians all over the Bay Area, including at Kaiser and Stanford and Oakland, and retired docs, saying that they wanted to come and share their story on the Nocturnist stage. And so I think storytelling in the oral format is something that's unique because, unlike writing, it's more casual and it's more intimate because you're in the room with the person. And then I think the audio, so we audio record all of our events, and we pick the stories we like and put them on the podcast, I think is also a very different and a very intimate way of interacting with stories. So unlike reading a book or reading an essay, if you pop in your headphones and you actually hear the person's voice speaking to you, there's a whole different level of intimacy there. And I think, podcasts are very hot right now. They're kind of exploding as a new medium. And so I really wanted to push the envelope and see what we could do with medicine and creativity in that sphere.
Completely agree. I often say that no matter what folks have been presenting at conferences and so forth, it's usually the stories they tell to illustrate their point that are the things that stick with me. So I completely agree in the value of hearing someone tell a story. So how are your physicians who are participating in this really using both the art and the intimacy and the science of storytelling to take back with them to be able to provide better care to their patients? Have you heard feedback that they've been able to change the way they provide care?
I think there's many different levels where this type of work is causing healing. And I think, first it's healing the healer. Like a lot of physicians, as I'm sure you know, are suffering from these epidemic levels of burnout and depression and even suicidality. And I think a lot of this has to do with structural issues in healthcare and kind of the way medicine is being automated and commodified, and physicians are asking to do more and more with less and less, and there's sort of depersonalization that's happening. And I think physicians are really facing a spiritual crisis where they went into medicine to be healers, and then they show up on the job and they find that it feels very different and it feels very dysfunctional. And they're also grieving the loss of themselves. Like often people will tell me that they feel really disconnected from their own humanity as they move through medical training. And so I think when people listen to these stories, the first layer of healing is like healing the doctor. Like how can a doctor heal their soul? And part of that is hearing other doctors tell stories that you can relate to, that you can map your own experience onto. And, some of these stories are, heavy and intense and sad, but some of them are fun and funny and like irreverent. And I think that can be really cathartic for people. Then the content of the stories, certainly I think people could bring to bear when they're taking care of patients. Unlike a lot of the other medical podcasts out there, we're not a medical education podcast. There are some awesome teaching podcasts like the Curbsiders and others that, we'll bring guests on to speak about like specific medical topics. And those podcasts are definitely changing the way that doctors, prescribe medicines and sort of educating themselves about the best practices of the medicine itself. But I think my podcast is really focused more on the human element and how do we bring that into our own lives and how do we bring that to the bedside. I also will say I've received emails from people at academic medical institutions who say that they're using the podcast episodes as part of their curriculum for medical humanities. So a lot of med schools and residencies now, they'll have, sessions on wellness and burnout, which is, in part a reaction to this crisis. And so I've had people email me and say that they'll assign an episode to their students to listen to, and then they'll come together to discuss the episode. And so I think while it was more intended to be consumed as an artistic product, it is now also being used in the classroom to teach humanism and to spark discussions, which I think is really important.
I agree that telling stories is one of the ways to address burnout and building that community. Have you found that community that you've built among those who are at the live performances and the live show are staying connected?
I do. We have a theater now. So I mentioned the 80-seat theater that we were producing the shows in a while back. Since then, we've actually upgraded to a new theater that has 350 seats. And we've been really, fortunately, successful in selling it out on multiple occasions. And when I look at the list of people who are RSVPing, some of the people are newbies, and some people, they're in San Francisco for a few years to do their training, and then they move to another city and they, can't come anymore. But a lot of the people who come are repeat audience members who I think are really finding a sense of community and devotion to the Nocturnists. And, we've even had some people reach out to us and offer to make donations to help support our work, which has been tremendously meaningful and also just practically necessary for us to be able to continue the work we're doing at the level and the quality that we're doing it. I had coffee with one woman who gave us a very generous donation, and we were both getting really emotional at this coffee shop. And she kind of took my hand and she was like, "You're doing something beautiful and I want to make a gift." And I don't know, I feel like we really have connected with the community here in the Bay Area. And we have really wonderful ties with Stanford too. They will often send up students and residents to perform at our shows. So it's providing a nice mixing of UCSF and Stanford people and Kaiser people. But we're also hoping to expand. We've done a show in New York City. We'll be doing another show in New York City this December, and I'm hoping that we'll start to build more of a community out there. And then there's the fact that the podcast can be listened to from anywhere. And so I'll get emails from people in the United States, but sometimes even like the UK, or I got one from Melbourne, Australia the other day, people who are listening really around the world. Because I think a lot of these experiences that doctors have are universal. No matter what culture you come from, everybody has the same body. And they've written to me and they've said, how can I bring this into my ICU at my hospital in Melbourne, Australia? So having a global community would be even better, but, we have to take baby steps.
So a little bit of advice for our listeners. How do you think leaders can use storytelling to lead better? I know you've had a number of different folks on over the years in the Nocturnists, but how do you think there's a way that leaders can really incorporate that value of storytelling?
That's a great question, and I think storytelling is a shortcut right into somebody's gut and right into somebody's emotions. And I always say that if you're trying to affect change or move someone to action or take on a new initiative, you can present the data and the graphs and the evidence, but if you don't pair that with some kind of narrative or story, it's not going to have the same emotional effect as it is when you combine the two. And I also think if you share a story but there's no data or evidence, it's also not going to be as effective because it could be, an outlier story that it's not really generalizable. So I think combining data and stories is really vital to advocacy, leadership. There's an entire course at Harvard that was spearheaded by Marshall Gans that's called Public Narrative. And he has like a multi-day workshop all about storytelling and advocacy and how you can use the story of self, the story of us, and the story of now to inspire the listener and move them to, usually there's some kind of ask, like, can you please take an action? And that's a little bit of a different flavor of storytelling than just storytelling for the sake of art. But I do think that it's probably one of the most effective ways to communicate information. If you think about, human beings and storytelling, we've been doing this for millennia. The Epic of Gilgamesh is widely considered to be like the first great story ever put down by human beings, and it was made in 2000 BC. It was etched into a stone. So humans tell stories as a way of explaining the world to ourselves and as a way of locating ourselves in the chaos of the universe and of our lives and of our jobs. And so I think whether you're doing it as a way to reflect and heal yourself, or you're doing it as a way to connect with an audience through art, or whether you're using it more strategically to be a leader or an advocate, it's a powerful tool and it has to be used responsibly.
So what advice do you have for those who are interested in starting to incorporate storytelling into their daily lives and activities?
That's a great question. I think it depends what your goal is. I think, journaling is something that a lot of people like to do just to start things off, especially if you're new to writing and storytelling, just kind of keeping track of your day and your thoughts, and then reading that back and kind of locating yourself in your life and what is the events of your day or even your week or your year or the last decade, like how are you framing that in terms of your own life story, and how might you look at that narrative and use it to guide your decisions going forward, I think can be really helpful. I think for people who are interested in the arts, just doing it is the most important thing. A lot of people talk about how they want to write or they want to paint or they want to start taking photos, but it's a whole different thing to actually like put your butt in the chair and write for 8 hours. There's a great book called The War of Art that's all about how art is hard and you have to fight the outer critics, but the hardest critic to fight is the inner critic. And how do you outrun that critic and, write a first draft that maybe isn't perfect, but it's a place to start if you're trying to create art. And then if you're interested in storytelling as a form of advocacy, there's a lot of different resources online, including Marshall Gans' course, Public Narrative, where you can learn more about the story of self, story of us, story of now, and how you can construct a compelling argument to, be a leader and move people to action. The Nocturnists is a source. There's also the Stanford Storytelling Project, there's Story Collider, there's StoryCorps. This is all more for the oral form. And then for writing, there's a lot of really great books out there on writing, including one I love that's called Bird by Bird by Anne Lamott, that talks all about how to, get started. So, yeah, I think it depends on who you are. Everything from private journaling for your own healing to, really wanting to be more of a professional artist, to wanting just to incorporate storytelling as a communication tool in the other types of work that you're doing. There are a lot of different entry points.
Well, Emily, thank you so much for sharing a little bit of your journey and how you've incorporated storytelling into your work and your profession. We very much appreciate you joining us.
Oh, thanks so much for having me. And so glad to hear that you'll be working with the folks from the Schwartz Center and that they had their own story slam. So that's great. It seems like the storytelling bug is really going around, and I think that's a good thing.
Completely agree.